1 in 6 men have prostate cancer in the USA. But why? When discussing prostate cancer rates in the United States, it's crucial to understand that the situation isn't unique to the US alone. Other developed countries also face high rates of this disease. The reasons behind these high rates are multifaceted, involving aspects like screening practices, demographic factors, lifestyle choices, and healthcare access. Firstly, the widespread use of PSA testing in the US plays a significant role. This test has led to more diagnoses, including cases that might not have caused harm if left undetected. Essentially, the US is catching more cases early thanks to rigorous screening, which inflates the statistics somewhat. So it doesn't matter which part of the globe you're from, prostate problems leave no man. Age and race are also key factors. Prostate cancer predominantly affects older men, and with a sizable aging population in the US, it's expected that more cases will be diagnosed. Additionally, African American men are at a higher risk compared to men of other races, and this demographic factor influences the overall statistics in the US. Lifestyle choices, including diets high in red meat and dairy, and the common processed foods in the states featuring obesity, are linked to an increased risk of developing prostate cancer. Remember, about 42.2% of US adults aged 20 and over were obese. This translates to roughly 1 in 2.36 individuals being obese. The healthcare system in the US, despite its complexities, offers broad access to cancer screening and treatment services. This accessibility means that more cases are likely to be detected and reported. To give you a sense of the numbers, the American Cancer Society estimated that in 2023, there would be about 268,490 new cases of prostate cancer in the US, and about 34,500 deaths from the disease. The lifetime risk for American men is about 1 in 8, which is significant. It's important to note that high prostate cancer rates are not exclusive to the US. Countries like Australia, Canada, and those in Northern Europe also report high incidences of the disease, according to the World Cancer Research Fund. The high rates of prostate cancer in the US are attributed to a mix of effective screening, specific demographic characteristics, lifestyle factors, and comprehensive healthcare access. This challenge isn't just an American issue, it's a global concern, particularly in developed countries. The key takeaway is that comparisons between countries need to account for differences in screening practices, lifestyle, and healthcare systems, all of which can influence the statistics surrounding prostate cancer. Remember, the information provided is for educational purposes only and should not substitute informed medical advice or care. Why you shouldn't be stubborn and ignore the warning signs. How to detect the signs early. Prostate cancer ranks as the second most prevalent cancer in men, with nearly 192,000 new instances reported in the US during 2020. Despite its widespread occurrence, a significant number of men remain uninformed about the symptoms, leading to potential delays in seeking treatment. Such delays can adversely affect survival rates. This blog aims to shed light on the critical symptoms of prostate cancer and emphasizes the importance of being vigilant about any bodily changes. Recognizing the signs of prostate cancer early on could be a lifesaver. The stark reality. Essential insights on prostate cancer. Prostate cancer stands as a major health concern affecting countless men across the globe. Here's a brief overview to bring to light the stark reality of this disease. To start, prostate cancer is the second most diagnosed cancer in men, just after skin cancer. Additionally, the chances of getting prostate cancer rise significantly as men age, especially after reaching 65. Though the root cause of prostate cancer remains a mystery, having a family history of the disease or belonging to certain racial groups can heighten one's risk. Crucially, catching the disease early is vital for effective treatment, with a high potential for cure when identified at an initial stage. These insights underline the necessity of being aware of and recognizing prostate cancer symptoms, a topic we'll delve into more deeply in the following segment. Keep an eye out for more vital information that could be life-saving. Listening to your body. Recognizing prostate cancer symptoms. Your body often signals when something's not right, and being alert to these signals can be key in spotting prostate cancer early. Knowing the typical symptoms is essential for timely medical action. While symptoms can vary, there are several common ones to be aware of. An increase in the need to urinate, particularly at night, may be a sign. Trouble with starting or stopping urination, or a weaker urine flow, can also indicate a problem. The presence of blood in your urine or semen should raise immediate concern. Additionally, experiencing discomfort or pain in the pelvic area or lower back might point towards prostate cancer. Symptoms like feeling overly tired, losing weight without trying, and difficulties with erectile function are also linked with this condition. If you notice any of these signs, it's important to talk to a healthcare provider. Catching prostate cancer early significantly boosts the effectiveness of treatment. Keep following for insights on the critical role of early diagnosis. The critical role of early detection in prostate cancer. Understanding the symptoms of prostate cancer marks the beginning of a journey towards safeguarding your health. However, the real change comes from acting on these signs by seeking early detection and proper diagnosis. It's common for some men to brush off their symptoms as just another sign of getting older, yet emphasizing your health's importance cannot be overstated. The early stages of prostate cancer offer the best odds for effective treatment and a hopeful prognosis. Routine checks, including the prostate-specific antigen test and the digital rectal exam, are key tools in spotting any unusual changes in the prostate. If you're showing symptoms or fall into a higher risk category for prostate cancer, making an appointment with a healthcare provider should be a priority. Ignoring symptoms or postponing a doctor's visit can lead to dire outcomes. When caught early, prostate cancer can often be contained and treated successfully. However, neglecting it allows the cancer to advance and spread, complicating treatment efforts. Committing to regular health screenings means you're actively looking out for your well-being. Don't let fear or hesitation stand in the way. Prioritize your health by ensuring prostate cancer is detected and addressed at its onset. Staying alert. Key risk factors for prostate cancer. Being proactive and informed about the risk factors for prostate cancer is vital for early detection and effective treatment. Although the precise cause of prostate cancer remains uncertain, there are identifiable risk factors that can elevate a man's risk for the disease. Age stands out as a notable risk factor, with most prostate cancer diagnoses occurring in men over 65. A family history of prostate cancer can also increase risk, especially if close family members have had the disease. Race is another factor, with African American men facing a higher risk compared to men of other races. Lifestyle choices, such as a diet rich in red meat and dairy, along with obesity, might also heighten the risk. Being aware of these factors allows men to take control of their health by monitoring their condition closely and adopting preventive measures to either thwart the onset of prostate cancer or catch it in its nascent stages. Treating and living with prostate cancer. Dealing with prostate cancer is tough, but there's a lot of hope because treatments have gotten much better. Now, men with prostate cancer have many options to help them get better and keep living their lives. The main ways to treat prostate cancer are surgery, radiation using high-energy rays to kill cancer, hormone therapy medicines to lower cancer growth, and chemotherapy drugs to kill cancer cells. What treatment you get depends on how serious the cancer is, your overall health, and what you prefer. There are also other kinds of treatments that help with symptoms and make you feel better. If you have prostate cancer, it's really important to talk with your doctors to figure out the best plan for you. Even though it's hard, many men with the right treatment and support can still do the things they love. Keeping a positive attitude, learning all you can about your options, and getting help from support groups are all good ways to handle having prostate cancer.